Hello, and welcome to the Second Medic tutorial on how to use your Second Medic web app. This web app is a collaboration between Second Medic and IFCO Tokyo, and it can be found on your IFCO Tokyo profile that you can navigate to from the web page. Once you have accessed the profile, you can click on the link and it will take you to this landing page. Here you can enter your name, email address, age, and where you're from. So let's get started. The web app can be used in a variety of different ways. The main way you'll be using it is via Tele Consultations. Here you can ask a doctor about any symptoms that you're having and what you can do about them. There are other ways of using the web app. COVID will give you access to COVID information. A second consultation if you're not sure about your diagnosis. Diagnostics to book any lab results or lab tests. E-pharmacy for prescriptions or renewing prescriptions. Home care for needs such as home nursing, physiotherapy, or medical equipment. Mental health to ask about your mental health diagnoses or for new mental health concerns. Nutritional care for any nutritional information such as dieting. Dental care, and even a wellness reward program if you utilize the service often. So let's start with a teleconsultation. Here you can see the basic form that is used throughout the web app experience. It'll provide the date of the request and your name, whether this is for you or for someone else. Put in your age, gender, and now the important questions. Describe the purpose of your consultation. What do you want to gain out of it? What concern do you have? What question do you want answered? What symptoms do you have? Here you need to be quite specific and provide as much information as possible. Have you had any investigations performed? If so, do you have the results with you? You may be asked to upload these results at a later date as well, when consulting with your doctor. After this, you may provide some additional information such as weight, height, blood pressure, and heart rate. This can help the consultation, but is not always needed. Once you press the Book Now button, your request will be submitted, and you will receive a phone call by us anytime between 9 a.m. to 9 p.m. within 24 hours to confirm the call. So you've seen how to do a primary consultation. What about the other options? First, here's COVID. The COVID Solutions tab will allow you to ask any information you have about a potential COVID diagnosis or any other queries you have about COVID. Here, it'll be helpful to put in any symptoms you may have, how long you have had the symptoms for, any comorbidities you may have. This is important to help us risk stratify you, as some people who get COVID are more at risk of getting the harmful effects if they have certain conditions. Additionally, we may ask if you have had a previous diagnosis, whether this was by swab or by symptoms, or if you have had to isolate. With the rollout of the vaccine, we're also now asking if you've had the vaccine, or if you have any questions about it. A second opinion is quite similar to a primary consultation, except you will have already received a diagnosis from a previous doctor, and you'll be using this service to get a second opinion, to check that the diagnosis is correct, or if there's a better treatment option for you. Therefore, please provide any diagnostic information provided to you by your previous doctor and the investigations they requested for you as well. This will help in making sure that you get the most accurate diagnosis and management plan. In the Diagnostics tab, you'll be able to request blood tests and other diagnostic investigations. Here it is helpful to tell us about why you want to get these tests, as we can tailor them for you and make sure that you don't over-investigate yourself and get unnecessary tests, or miss out any tests that would actually be helpful for you. Similarly, If you list the diagnostic tests required, such as cardiac tests, renal tests, liver tests, we'll be able to tailor them again for your needs. If there are any specific ones that you know you need to get, such as a full blood count, your ureas and electrolytes, and so on, you can list them in the third box. The e-pharmacy will allow you to refill all or some of your prescriptions based off the prescription provided by another doctor. You will need to upload proof of this prescription, as well as which medications you require. Please provide the medicinal name, the quantity, and also the frequency and how long you're going to take the medication for. This is the basic information required to dispense medication safely. Additionally, at the bottom, you can provide information on any allergies you have, which is extremely important for your safety. And we need to cross-check your allergies to make sure that we aren't providing you with anything that could create an allergic reaction. Home care is rather simple. Tap here for more and identify which care service you require. Once you have identified it, please write why you require that care service and what you aim to get out of it. We will tailor the rest of it further in the consultation with your doctor. The Mental Health tab will allow you to discuss your mental health or any concerns you have for it with your doctor. Again, the basic information you need to provide include what you wish to gain out of the consultation, what symptoms you've experienced, new, old, or worsening, any previously diagnosed mental health conditions that you may have, and of course any current or previous medications that you have been on, and any increases or decreases in these medications. Again, the more information that we get, the better the diagnosis and the better your management will be. To tailor your nutritional consultation to what you need most, we need to understand why you wish to undergo this consultation. So what do you want to achieve? Do you have any dietary requirements or any dietary aims? How often you exercise is quite important, as this determines your calorie input and output, and therefore how much or how little you need to eat. And any previous diagnoses or surgeries that may impact your calorie requirements. Examples include surgeries such as gallbladder removal, surgeries on your bowel, your stomach, bariatric surgery, and any other diagnoses such as high cholesterol, diabetes, thyroid problems. In the bottom, please put in your weight, your height, your waist circumference, and your hip circumference if you can provide it. These will help find out your BMI and also estimate your body fat percentage. This will again help tailor your needs and requirements and your goals. Finally, for today, we'll briefly look at the dental health plan. Here you can ask your dentist about any questions you have, any symptoms you've been having related to your teeth, so toothache, pain when chewing, any investigations such as dental x-rays that have been performed, and also if you've been diagnosed by a dentist about any previous conditions, any root canals that have been performed, any cavities that have been filled, so on. As you can see, the web app is quite extensive and can be tailored to your needs. So use it as you require. Be aware that while some services are free, others may be paid and require additional funding on top. Thank you for listening, and we hope you found this useful. If you have any further questions, please go to our website or send us an email, and we'll get back to you as soon as we can. Thank you.